Good afternoon, everyone. Thank you all for joining us at our first information session about the Behavior Risk Alert Safety System, which will be a function embedded within SMIS. And we have the next 2 hours set aside for this session, and we'll see if we need to use all of it, but we definitely have a full agenda for you folks. I'm going to start us off with some introductions, and then I'll let you know a bit about the flow of the next couple of hours. So I'll start with myself. I'm Tina Palavan. I'm a Policy Development Officer here in Toronto Shelter and Support Services within the Strategic Policy and Service Planning team. And I use she and her pronouns. And I've been grateful and honored to be leading this work with some of my colleagues on the line here. And I'll just pass it over to Bonnie to introduce herself as well. And then everyone else, go for it, Bonnie.
Thanks, Tina. I'm Bonnie Wakely. I'm a manager of operations and support services with the Homeless Initiatives and Prevention Services section of the division, which is really our operations section. So very happy to be here today. And as Tina mentioned, we have a full agenda for you. So I'm going to turn it over to Maria for her introduction.
Thank you, Bonnie. Good afternoon, everybody. My name is Maria Ignacio. I am the Advisor of Strategic Workforce and Development. I supervise the training and development team, which is within the People Services Unit. And Katanya.
Good afternoon, everyone. I am Katanya. I am also a member on the Training and Development Unit with People Services. I'm glad to be here to assist in the moderation of this great, fantastic new tool.
Thank you so much, Katanya. So as Maria was briefly mentioning, just some housekeeping. This is a webinar style format meeting. So unfortunately, we won't be able to see you this afternoon, but you'll be able to see us. You'll be able to submit your questions through the chat. And if you submit to everyone will be able to see your question, but you also have the option to just submit it to the panelists, which will be us four. That's totally up to you. We have a good chunk of time dedicated later in the afternoon for question and answer. So that'll probably get started around 3 or 3:15. So if we don't answer your question right in the moment, which we might do some of that in the chat, we will definitely get into it in the second half of the session. And I'm going to start us off with a few slides to, ground us and let you know a little bit about what this afternoon is going to look like. But before I do that, I just wanted to hand it off to Bonnie for some opening remarks about BRAS and kind of just some greetings about the topic for this afternoon.
Thanks, Tina. And I'm sure many of you who are joining us today have participated in the past in some of our engagement sessions. We've been talking about BRAS really for years now, and I know it's been a long journey to get here. We had started this work before the pandemic and had to kind of pick it up again, and we've had various team members with different pieces of the leg of the journey. So we're very pleased to be here today to be able to talk to you about the launch of the system. Also, this is not something that we're kind of launching and walking away from. We know that there's going to need to be support to implement this system. It will be, a change management exercise really for our sector. And so we as a division are really invested in supporting you through this journey. And so, we may not get to everything today. We're going to have future opportunities for additional training sessions later in the summer. But today is really kind of our first pass at sharing with you, how we envision the system working as we prepare for that change to happen later this week in Smith. Tina, back to you.
Thanks for that, Bonnie. And it's a bit of a happy coincidence that today marks the day, the first day of Workplace Violence Awareness Week. As you'll soon hear me talk about, BRAS is a tool that's intended to support our workplace violence prevention efforts within the shelter system. So that is a happy coincidence, and that is the background you're noticing on our end. So I'm just going to share my screen and get a go-ahead from my co-panelists that they could see my screen. Great. Okay, so I'm going to start this afternoon on just giving you a brief synopsis of how we got here to this launch point, which will happen this Wednesday, April 24th. That's when this will become effective. And I'm going to elaborate a little bit on some of the things that Bonnie started to speak about, which is how we intend to support the rollout of this feature. And then our good chunk of our afternoon is actually some training material, which Maria is going to walk us through. It's a module of sorts, and we're looking forward to folks have feedback or want further points of clarity. Like that's what the discussion and the question and answer is going to be for. So we're definitely looking forward to your feedback on that. I do just want to start this afternoon off with a land acknowledgement to ground us and set us off on a good note. So I'd like to acknowledge that the land that I'm joining you all from here today is the traditional territory of many nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nation, Inuit, and Métis people. I'd also like to acknowledge that Toronto is covered by Treaty 13 with the Mississauga of the Credit. Just let that sit for a moment. Yeah, okay. So I'm going to start us off with a very brief introduction as to what BRAS is, because the training material is really going to go into depth about this, so I don't want to spend too much time on it. But really simply put, this is going to be a new feature in SMIS that will generate safety alerts, which in SMIS will be named as behavior risk alerts, that will appear on a client's SMIS record following an incident of workplace violence. And really, it's designed to communicate the potential of workplace violence to staff and workers and increase information sharing about clients with a history of violent behavior. So really what that means is if a client is part of an incident of workplace violence in one shelter, in shelter A, shelter B will be able to learn more information about that client's history of violent behavior, just as it relates to the incident that led to that alert. And the goal of that is really to support service providers in proactive safety client planning for clients with a history of violent behavior. That might seem a bit confusing for now, but please trust the process, and hopefully the training material is going to go much more in depth about this. But really at large, it's about increasing information sharing about these clients who have a history of violent behavior. And just to note, our clients remain the same. BRAS is not going to change any of this. It's just going to allow for providers to have more information, whereas before there is such limited information sharing in SMIS. But as it relates to specifically violent behavior, there will now be increased information sharing. So we'll get way more into that through the training material. I just want to note for you folks really like how we've got here. As Bonnie was beginning to mention, this has been work that's been underway for quite some time, and it got delayed for a bit as we rededicated our efforts in the division to address the COVID-19 pandemic. But over the last 1.5 to 2 years, we've been able to reinvest in this work, and we're very pleased that we're at a place where we can launch it in SMIS. And you may have noticed over the last few years that there's been changes that have been happening in SMIS, as well as, engagement and sector work that Bonnie and I have been leading to try to onboard folks onto what this is really about, what it could look like, and receive input on how we can do it and implement it in a good way. So, as you'll see in the training material, BRAS is not it's not going to be a brand new thing in SMIS. It's actually just an extension of SMIS's incident report module. And over the last 3 years, through various SMIS updates, we've been making enhancements to that module to be able to better document incidents of workplace violence in SMIS. And you may have noticed that here or there, we've had different training sessions about that, but really that was setting the groundwork and the foundational work for BRAS, and you'll know exactly what I mean with that when we go through the training material. But that's something that we've been trying to ease the sector into better documenting instances of workplace violence and naming it within SMIS, and really BRAS is just going to be an extension of that incident report module. You may also recall, as Bonnie mentioned, some of you may have participated in a series of engagement sessions we did in the spring of 2023. Where we were pleased to be able to engage over 90 individuals ranging from operational supervisors, executive directors, other folks in senior leadership across, the different sectors, youth, families, adults. And those information sessions were very informative for us not information sessions, sorry, engagement sessions were very informative for us as we got to learn, how this might look for you folks on the ground and what supports you might need to better be able to support implementation, as well as, trying to see if we can address some of the concerns that were coming up around this. So we were really pleased to have the opportunity to do that engagement. And really one of the key things that came out of that engagement is that we decided to form a BRAS implementation advisory. And some of the members of the advisory may be here this afternoon. If you are, good to have you here. But really, I believe it was early last fall, we did a call out to the sector to see who would be interested at sitting at this table. And we did a bit of like a survey to see who would be interested, what kind of sector, what shelter sector you worked in, because we wanted a diverse advisory. We didn't want folks like all just from like one, like all from youth sector, or all from adult sector. So we wanted a good representation. And through that call out, we were able to secure, I believe, 12 to 13 people who were interested in joining the advisory. And we've had quite an engaged group, and we've been really pleased to work with you folks. So I just want to shout out the advisory. We've had a chance to meet a few times now, and that is really was our one of the efforts we wanted to definitely ensure that we were investing in, to ensure that like we understood what it would look like for our community providers to implement this system. So that's a high level piece of how we got here. It's the very clean version. There was also a lot of other things going on. We had a lot of engagement internally, and it's been a long road to get here, but we feel confident that we're in a good place. And that being said, there is still a lot of unknown, but that's what Bonnie and our teams are here to support with the rollout. And that's actually what I want to get to before we start with the training material. So, these are just kind of the three key things that I wanted to, ensure folks on the line about, that we will be available to support with answering questions or troubleshooting as this rolls out within SMIS. And we have kind of an internal setup to triage questions and get responses. But what you need to know is that if you have any questions that come up, you can contact your agency review officer as a first step, and they will work with our team to ensure that you get the appropriate response. And they are well aware that this is being launched in SMIS, and all the work that's gone into it. So we're here to support you and support with troubleshooting. We will also be releasing the training material. So this session is being recorded, and it will be made available on the city's website very shortly. We will also be having 2 additional upcoming sessions that are already scheduled, one on Thursday, May 30th, and one on Wednesday, June the 5th. We may do additional sessions as we, hear back from the sector and see kind of the response. But those sessions will also be recorded and made available. We are planning on releasing the training material that we're going to go through today. We will eventually, a little bit down the line, we'll be releasing it as a self-run module that folks can access and go through themselves at their own time and pace. But we are kind of taking the approach of doing these information sessions / training sessions facilitated by us and Maria, just so we can see if the training material is landing and if there's any updates we need to make before we kind of land on that final self-paced module that we'll make available on the city's website. So the material is quite developed, but it is still open to being updated and tweaked based on what we hear from you folks and our advisory as well. And just so you can be rest assured, when this launches and moving forward, head office at Toronto Shelter and Support Services is going to be playing a system oversight kind of role over BRAS, and we will be closely monitoring the system to ensure the responsible use. And I just wanted to really comment on that, and that that we're, like Bonnie was saying, we're not just turning it on and walking away. We will be on our end closely monitoring it and ensuring that it's rolling out as intended. So with that, I don't know if there's any other comments from my co-panelists before we kind of move into the training material. I'm seeing shaking heads. Okay. That's all from me. We will go through the training material. It's a bit lengthy, and we were hesitant to pause it because we want some of your questions may get answered as we go through the module. But feel free to put your questions in the chat. And as I was mentioning, we'll have a good amount of time in the last hour of the session to get to those questions. So without further ado, I'm going to pass it on to Maria and take it away.
Thank you, Tina. Okay. Quick thumbs up, please, that you guys can see my screen. It's just a black screen right now. Perfect. And then just a thumbs up to confirm that the audio is also going through. Nope, it's not, because I don't even hear it on my end. Sorry. Welcome to the Shelter Management Information System, also known as SMIS, Behavioral Risk Alert Safety System Training Module. Did you guys hear the audio okay?
Yes.
Okay, perfect.
Thank you.
Thank you.
Learning objectives. This training will cover 3 key sections. In Section 1, introducing SMIS's Behavioral Risk Alert Safety System, also known as BRAS, we will go over what BRAS is, why BRAS is in place, guiding principles for responsible use of BRAS, an overview of BRAS procedures, and notifying clients of BRAS. In Section 2, completing the Incident Report module for incidents of workplace violence, we will go over SMIS's Incident Report module for incidents of workplace violence, definitions of workplace violence, responsibly completing incident reports in SMIS, and employer responsibilities. Finally, in Section 3, we will go over completing intakes for clients with behavioral risk alerts. The Behavioral Risk Alert Safety System, also known as BRAS. This section describes what the Behavioral Risk Alert Safety System is, why it's needed, the guiding principles and terms of responsible use for the system, and the policies and procedures for operationalization at shelter sites and other programs using SMIS. Select each box on the computer monitor to learn more. Please note, each box must be selected and reviewed before you are able to move on to the next slide. What is BRAS? The SMIS Behavioral Risk Alert Safety System generates safety alerts, named in SMIS as Behavioral Risk Alerts, that appear on a client's SMIS record. BRAS is designed to support service providers using SMIS in proactive safety planning for clients with a history of violent behavior. How does it work? Select the cards below to learn more about what BRAS is. BRAS acts as a system to communicate the potential risk of workplace violence to staff. Select the Close button to return to the base slide. BRAS generates safety alerts named in SMIS as a behavioral risk alert that appears on a client's SMIS summary page to indicate that the individual has been involved in an incident of workplace violence that resulted in or could have resulted in serious physical injury to staff and/or clients. Alerts are visible to SMIS users across both City of Toronto directly operated shelters or community-operated programs, regardless of which program recorded the incident of workplace violence. Safety alerts can be found on the Client SMIS summary page. Select the Close button to return to the base slide. BRAS allows for information sharing about a client's past behavior to inform safety planning for individuals with history of workplace violence. Select the Close button to return to the base slide. Why is BRAS needed? Now, why do we need a behavioral risk alert safety system? Toronto Shelter and Support Services, also known as TSSS, has operationalized BRAS in order to meet legislative requirements under the Occupational Health and Safety Act, which details that 1. Employers must provide workers with information, including personal information, related to a risk of workplace violence from a person with a history of violent behaviors. And 2. That workers have a right to know about hazards in their work and get information, supervision, and instructions to protect their health and safety on the job. Meet responsibilities required of Toronto Shelter and Support Services as the service administrator of SMIS to create a system to share information stored in SMIS about clients using shelter and homeless services with a history of violent behavior. Enhance shelter safety and reduce incidents of physical violent behavior. Guiding Principles and Responsible Use, Part 1. Workplace violence can be devastating for everyone involved and can lead to injury, psychological trauma, workplace stress, and fear, which is why TSSS is committed to the prevention of workplace violence within the shelter system. Our clients, whether in a shelter or the community, may be experiencing crisis and can display a range of cognitive, emotional, and behavioral responses which may escalate to workplace violence, affecting our workers and other service users. Occurrences of workplace violence are serious and require immediate intervention and support at shelter sites. Organizations are responsible for following their respective workplace violence program policies and procedures. Guiding Principles and Responsible Use continued, Part 2. The responsible use of BRAS must be a sector-wide commitment. To guide the operationalization and oversight of BRAS, the following guiding principles have been identified and embedded throughout the development and implementation process. Select the circular icons to learn more. Please note, each icon must be selected before you can move on to the next slide. Privacy. The implementation of BRAS will not disclose any more client information than is reasonably necessary to protect workers from physical injury and will adhere to the city's obligations to protect client privacy and confidentiality. Responsible use. Safety alerts should not be the cause for or the result of discrimination, bias, and/or unfair treatment of clients. Access. Safety alerts should not create service barriers or be used to deny individual access to shelter programs. Transparency. BRAS policies and procedures will be transparent and accessible to clients and include processes for appeals and reviews. Quality control. TSSS will routinely review alerts to ensure responsible use of system and timely removal of alerts. An overview of BRAS procedures, Part 1. What role do you play? The foundation of BRAS is SMIS's Incident Report module. Behavioral risk alerts are the result of a completed incident report in SMIS, which indicated that an incident of workplace violence occurred at the site and which client or clients engaged in the violent behavior. The second half of this training will dive further into definitions of workplace violence, serious occurrences, and a step-by-step procedure for completing SMIS's Incident Report module. It is important to remember, documentation of incidents of workplace violence in SMIS do not replace an organization's existing workplace violence policies and procedures. Employers are required to take all measures necessary to create a safe and healthy workplace in accordance with the Occupational Health and Safety Act. An overview of BRAS procedures continued, Part 2. How alerts are actioned in SMIS. Select the boxes below to learn more. Please note, all 3 steps must be visited before you can move on to the next slide. Note, Every approved SMIS incident report involving workplace violence will generate a BRASS alert on the client's SMIS record. Multiple alerts may appear. Behavioral risk alerts are not a permanent designation. TSSS routinely reviews alerts to ensure responsible use of system and timely removal of alerts. Step 1. As required by Toronto Shelter Standards and 24-hour respite site standards, sites are required to complete incident reports in SMIS's Incident Report module. When a serious incident of workplace violence occurs, one that resulted in or could have resulted in serious physical injury to staff or other residents, SMIS users document the occurrence using the Incident Report module. Select the Close button to return to the base slide. Step 2. Incidents of this nature require review and approval by an individual with SMIS supervisor role access before the incident report can be completed. Select the Close button to return to the base slide. Step 3. Once an incident report detailing an incident of workplace violence has been reviewed and approved by a SMIS supervisor, a behavioral risk alert automatically appears on the client's summary page. Select the Close button to return to the base slide. An overview of BRASS procedures continued Part 3. How SMIS users respond to alerts. When a SMIS user opens a client summary page for a client with a behavioral risk alert, messaging is displayed prompting the provider completing the client intake to contact TSSS's duty office. The provider completing the client intake contacts the duty office to request information about the incidents that led to the alerts. The duty office is responsible for reviewing incident reports and providing the site, also known as the provider, with only the necessary information about the incident to support the site with developing and implementing preventive measures to prevent a similar incident from reoccurring. Before sharing information, the duty office will ask to speak with the most senior staff on site. They will document who they speak with and the information provided. Under no circumstances should shelter providers share the duty office phone number with clients. Should clients have concerns or questions about BRASS, shelter providers are to direct clients to TSSS's complaint process. Select the button below to learn more. Note, the button must be selected to move forward in the training. Who is the duty office? The System Oversight Duty Office supports 24/7 shelter and service system delivery by monitoring and maintaining system awareness, identifying risks, supporting the management of issues to reduce impact to service delivery, and responding to service disruptions as they arise. Duty officers receive extensive training in privacy and confidentiality and take all measures necessary to protect an individual's privacy under the Municipal Freedom of Information and Protection of Privacy Act. Later in this training, we will delve further into a step-by-step procedure on how to complete an intake for an individual with a behavioral risk alert. Remember, safety alerts should not create service barriers or be used to deny individual access to shelter or other service programs. Our clients remain the same. BRASS simply provides us with more information to better support clients who have been involved in past incidents of violence. This can include creating more tailored support case plans or safety plans. Select the Close button to return to the base slide. Policies and procedures for operationalization at shelter sites. Transparency is an underlying principle of the SMIS Behavioral Risk Alert Safety System. This means that clients are informed about the use of the BRASS system in shelters and other programs and how their information is shared if they engage in violent behavior while accessing services. During all shelter intakes, staff are required to notify clients about BRASS when sharing SMIS's Notice of Collection Information form with the client, emphasizing that basic personal information will be linked to all shelters to preserve the safety of individuals. Select the SMIS Collection of Information button below to learn more. Completing the Incident Report module for incidents of workplace violence. In this section, we will go over SMIS Incident Report module for incidents of workplace violence, definitions of workplace violence, responsibly completing incident reports in SMIS, and employer responsibilities. Let's start by reviewing the features in the SMIS Incident Report module that supports the Behavioral Risk Alert Safety System and the application of key guiding principles that are to be applied in the operationalization of BRAS. Select each box on the computer monitor to learn more. Please note, each box must be selected and reviewed before you are able to move on to the next slide. Nature of incidents, workplace violence. When you are creating an incident report in SMIS, the list of nature of incident types includes options that relate to potential incidents of workplace violence, such as physical assault against resident or attempt, physical assault against staff or attempt, possession of firearm within the site, property damage, threats, throwing objects, verbal abuse against resident, verbal abuse against staff, wielding weapons or dangerous object, other behaviors. When any of these options are selected, the SMIS user will be prompted with the following question, with the option to select yes or no. Nature of incidents, workplace violence continued, part 2. Not all incidents that happen result in workplace violence and serious physical injury to staff. However, they can. For example, an incident of property damage could have resulted in serious physical injury to staff if an individual threw a chair at a person and it hit and broke the window, in which case the answer to the question, did this incident include a statement or behavior that is reasonable for a worker to interpret as a threat to exercise physical force against the worker that could cause physical injury to the worker, would be yes, and the SMIS user would select yes. Selecting yes will trigger the additional prompts that the SMIS user is required to complete. Press next to learn about the next point of completion for an incident that has involved workplace violence and serious risk of physical injury to staff or clients. Remember, you can select multiple nature of incident types as required. Workplace violence, definition. Let's review the definition of workplace violence, the role of racism and harassment in serious incidents, and employers' responsibility as it relates to workplace violence programs, policies, and procedures. Definition. Workplace violence is defined by the Occupational Health and Safety Act and the City of Toronto's workplace violence policy as the exercise of physical force by a person against a worker in a workplace that causes or could cause physical injury to the worker. The exercise of physical force by a person against another person in a workplace that causes or could cause physical injury to the worker. An attempt to exercise physical force against a worker in a workplace that could cause physical injury to the worker. A statement or behavior that is reasonable for a worker to interpret as a threat to exercise physical force against a worker in a workplace that could cause physical injury to the worker. Remember to conduct a review of your own organization's existing policies and programs related to workplace violence. Click on the button below to be redirected to the City of Toronto's workplace violence policy. This link provides you with the policy. However, all directly operated shelters, as well as purchase of service programs, should have a workplace violence policy and program in place specific to their organization. Workplace violence definition continued part 2. Due to legislative requirements of recording and sharing information to workers about clients with a history of violent behavior, we are limited to using the OHSA definition of workplace violence. TSSS acknowledges that acts of racial violence and harassment impact staff. It is strongly recommended that incidents of this nature are documented, escalated, and managed according to the organization's policies and procedures on harassment and discrimination. TSSS is working towards ensuring that these types of incidents can be recorded in SMIS. Responsibly completing the incident report module, identifying clients involved. The first prompt asks which of the clients you have noted under involved in this section here was responsible for the nature of incident identified. You have the ability to separate and specifically identify which of the clients involved engaged in the specific activity. For example, you'll see here that physical assault against resident is selected, and the client involved noted here below is Robert Price. Then, wielding weapon or dangerous object is selected, and the client involved noted here below is Kyle Richardson. Please note, these names were created in the SMIS training environment. They are not real clients. Responsibly completing the incident report module continued part 2, causation prevention section. As previously indicated, when you click yes to the nature of incident being classified as a workplace violence occurrence, you have additional prompts to respond to. The first prompt allows you to identify clients involved. The second prompt asks you what root causes led to this incident. When we discuss the role of the duty office in sharing information with providers about a client's history of violent behavior, it's important to note that the information shared with providers is limited to what will be useful in the development of safety plans or case plans that will support clients in the next program they access to hopefully not experience a reoccurrence of behaviors that escalate to the point of physical injury to others. To better support client success in our programs, it's important to understand and document the details of incidents that occur, why they happened, who was impacted, client and staff involvement, and how the events of an incident could have potentially led to or why they led to a workplace violence occurrence. Though this causation prevention field may be optional, we strongly encourage its completion because as service providers, we want to ensure that what we learned from incidents of workplace violence can be used to decrease the likelihood of future incidents of violence in our programs and shelter sites. Select the example button below to learn more. Bob and Harry engaged in a physical altercation, and as staff intervened, Bob accidentally pushed the staff aside, and Harry purposely broke the window in their dorm. Then, when completing this incident report in SMIS, I'd check off both property damage and physical assault against staff because this occurrence does meet the definition of workplace violence. I will then switch both options to yes, and under property damage, the client involved I'd note is Harry, and under physical assault against staff, the client involved I'd note is Bob. The incident reporting module gives you the option to identify causation and prevention, which can potentially reduce risk in future and hopefully prevent similar incidents from happening again. I later determined that Bob and Harry got into a fight because Harry touched Bob's dog without asking for permission, which is what escalated the whole situation. So now, when prompted, I would document why the two clients got into a physical altercation and that Bob does not like anyone touching or intervening with his dog. this would be my opportunity to include next steps, such as safety planning, and recommendations for future engagement, such as do not allow anyone to touch or intervene with Bob's dog without his permission. In the incident details section, I would also intentionally include that Bob accidentally pushed the staff aside, and similarly, Harry, out of anger and frustration, purposely inflicted property damage. It's important to note these details so that we, as service providers, can better mitigate risk and impact on the clients involved in a workplace violence occurrence. Select the Close button to proceed to the supervisor approval for incidents of workplace violence slide. Responsibly completing the incident report module continued part 3. Supervisor approval for incidents of workplace violence. For incidents involving workplace violence, incident reports in SMIS can only be approved and completed by a supervisor with SMIS supervisor access rights. This feature is in place because it is a requirement of BRASS that all incidents of workplace violence documented in SMIS be reviewed and approved by the site's supervisor or management staff. This means incidents where a staff person indicates yes to the prompt, did this incident include a statement or behavior that is reasonable for a worker to interpret as a threat to exercise physical force against a worker that could cause physical injury to the worker? Require a review and supervisor approval in SMIS before the incident report can be completed. SMIS supervisor approved and completed incident reports action behavioral risk alerts on a client's SMIS file. Incidents that do involve a statement or behavior that resulted in or could have resulted in physical injury to staff or residents will action a behavioral risk alert in SMIS. When actioned, behavioral risk alerts will appear on a client's SMIS summary page to indicate that the individual has been involved in an incident of workplace violence. The alert will be visible to all SMIS users across all programs using SMIS. Responsibly completing the incident report module continued part 4, monitoring incidents in SMIS's incident record list table. The incident record list table is an important tool for supervisors and management staff with SMIS supervisor access rights. BRASS requires that supervisors play a key role in reviewing and completing incident reports that involve workplace violence. The incident record list table allows supervisors with SMIS access to filter for incident reports that involve workplace violence. Note, this feature is only functional for SMIS users with supervisor role in SMIS. Select the icons to learn more about the purpose of this table and what supervisors will keep track of. Not completed. Incidents labeled as not completed refer to incident reports that do not involve workplace violence and have not been finalized. Completed. Incidents that are labeled as completed refer to incident reports that do not involve workplace violence and have been finalized. Rejected pending further review. Incidents that are completed and not approved upon initial review are labeled as rejected pending further review, meaning the record had been created and involved an incident that the writer identified as an incident involving workplace violence, but upon initial review, the reviewing supervisor did not approve. This selection allows the supervisor to save the incident without finalizing it and return to reviewing it to make a final decision. This selection does not result in a behavioral risk alert being actioned and no alert is placed on the client's SMIS record. Pending approval. Incidents that are pending decision are labeled pending approval, meaning the record has been created and involved an incident of workplace violence and is pending supervisor review to complete the report. Approved. Incidents that have been reviewed and approved are labeled as approved, meaning the record involved an incident of workplace violence and has been reviewed and signed off, resulting in a behavioral risk alert. Rejected. Incidents that are completed and not approved are labeled as rejected, meaning the record had been created and involved an incident that the writer identified as an incident involving workplace violence, but upon review was not signed off on by a supervisor. These incidents do not result in a behavioral risk alert being actioned, and no alert is placed on the client's Smith's record. Select the Close button to proceed to the next slide. Responsibly completing Incident Report Module continued, Part 5. The City of Toronto and TSSS acknowledges that racism is deeply entrenched within policies and practices that reinforce beliefs and attitudes. While BRASS aims to enhance safety within the system, it is essential that shelter staff exercise caution and sensitivity when documenting incidents and deeming it to be a workplace violence occurrence. Understanding the root cause is critical when deciding to switch that button to a yes. Racism can have many psychological sources: your own cognitive biases, personality characteristics, ideological worldviews, psychological insecurities, a perceived threat, or a need for power and ego enhancement. Though many of these sources do not involve malicious intent, it's very important that we are aware of these psychological sources and focus on the incident, individuals involved, our involvement, and what led to this occurrence. As service providers, we want to ensure our clients are not disproportionately targeted or disciplined. Employers' responsibilities. Everyone should be able to work in a safe and healthy workplace. The Occupational Health and Safety Act sets out roles and responsibilities for workplace parties with respect to workplace violence and workplace harassment, including developing and implementing policies and programs. Employers must prepare a policy with respect to workplace violence, develop and maintain a program to implement the policy. Employers must provide information and instruction to workers on the contents of these policies and programs. Employers' responsibilities continued, Part 2. The Workplace Violence Program must include measures and procedures for controlling risks identified in the assessment of risks, summoning immediate assistance when workplace violence occurs or is likely to occur, and workers to report incidents of workplace violence. Workplace violence programs must also set out how the employer will investigate and deal with incidents or complaints of workplace violence. As previously stated, documentation of incidents of workplace violence in SMIS will not replace an organization's existing workplace violence policies and procedures. Organizations are expected to meet standards required by the Occupational Health and Safety Act. Additionally note, the City of Toronto is the service administrator for SMIS and service system manager for city-funded shelter and support services, but does not retain responsibilities as an employer for third-party agencies. Reminder: before selecting whether an incident meets the definition of workplace violence, it is important to understand how to make that decision and to ensure we are making this decision with an empathetic and equitable lens. In this case, deeming an occurrence to be of a workplace violence nature could potentially come with unnecessary client monitoring, a transfer to another program, unconscious biases, and could impact rapport building and trust with that client. Reminder continued, Part 2. A quick reminder of a few key messages related to the Behavioral Risk Alert Safety System. Again, it's a mechanism to support prevention of workplace violence, but will not replace an organization's existing workplace violence program. Remember that these safety alerts should not result in a service restriction or create any barriers to service. We want to ensure that the system is fair and justifiable. This doesn't mean we want to treat and approach the system equally for all clients in our program, because in reality, fairness requires treating people equitably, which may entail treating people differently, but in a way that makes sense. To be clear, different treatment is not the same as special treatment. The latter is tied to favoritism, not equity. The Behavioral Risk Alert Safety System was thoughtfully developed to ensure that our clients are not disproportionately targeted or disciplined as a result of BRAS processes or features. Completing intakes for clients with behavioral risk alerts. This section provides a description of operational procedures for completing an intake for an individual with a behavioral risk alert. Select the box on the computer monitor below to learn more. Please note, this box must be selected and reviewed before you are able to move on to the next slide. Completing intakes for clients with behavioral risk alerts, Part 1. To protect client privacy, safety alerts do not include details regarding the incident. They instead direct the provider to contact the duty office for the relevant details related to the client's past violent behavior. The intent of BRAS is to advise SMIS users across the shelter system if a client they are providing service to has been a part of a previous incident of workplace violence, so the site is better able to improve safety planning for these clients. Completing intakes for clients with behavioral risk alerts continued, Part 2. Let's talk about what a shelter staff should do when conducting an intake for an individual with a behavioral risk alert. Select steps 1 to 4 and the Duty Office button to learn more. Please note, each button must be selected and reviewed before you are able to move on to the next slide. Step 1. Client arrives at shelter. Shelter staff enters the client's SMIS ID and sees the following notice. The notice prompts the caller to contact the Duty Office for more information. The shelter staff should take note of the alert but continue to complete the intake process as they regularly would. Note, a behavioral risk alert is not a notice of imminent danger or alarm. Select the Close button to return to the base layer. Duty Office. What is the Duty Office? Let's review. The System Oversight Duty Office supports 24/7 shelter service delivery by monitoring and maintaining system awareness, identifying risks, supporting the management of issues to reduce impacts to service delivery, and responding to service disruptions as they arise. Duty officers support BRAS by sharing information with providers about a client's past violent behavior when they enter a new program. Select the Close button to return to the base layer. Step 2. Once the client has been admitted, the staff conducting the intake should notify a supervisor of the admission. It is encouraged that the most senior staff on site contacts the Duty Office to receive more information regarding the behavioral risk alert. It is recommended for the site to contact the Duty Office within 24 hours of admitting the client. Select the Close button to return to the base layer. Step 3. Shelter site contacts the Duty Office and notifies them that they have admitted a client with a behavioral risk alert. The Duty Office will proceed to ask for the client's SMIS ID, review the incident reports which led to the placement of a behavioral risk alert, provide site with only the necessary information related to the past incident, and document the call with the site for record-keeping purposes. Select the Close button to return to the base layer. Step 4. Upon receiving the information from the Duty Office, it is recommended that the site document the information provided, implement necessary measures to support the client in accordance with the site's health and safety protocols. This could include, but is not limited to, developing a safety plan or specialized case plan, implementing preventive measures, and notifying staff on site who will be encountering this client in the course of their work. Note, The shelter site should take all steps necessary to protect an individual's personal information and limit information sharing to only the information necessary for workers to do their jobs safely. This means the details the duty office shares with the supervisor does not need to be shared with all staff in the shelter. Rather, the preventive measures and safety plan information formed as a result of the information received by the duty office is the information that is to be shared widely with staff on site. Select the Close button to return to the base layer. Congratulations! You have reached the end of this training and have successfully completed the module. The next slide will contain QR codes and links to check market surveys. Please ensure you complete the surveys to obtain a record of completion for this training module. So, there's one section in particular that I don't recall reviewing, and it's possible that I may have prematurely clicked through it. So if it's okay, Tina, I'm just going to revisit that slide because I want to make sure that I capture this information for the sector, okay?
Was it notifying?
Yes,
Okay.
which is this right here.
Okay. No worries. Thanks.
Sites are to also refer clients to the Notice of Collection describing BRASS, openly displayed at the program site. Sites should print the following Notice of Collection to display in an accessible location in the program site. The visual aid will outline a Notice of Collection notifying the client that personal information will be collected for the purpose of BRASS. Select the BRASS visual aid button below to access the document to print. Select the What do staff tell clients button to learn more. Staff are to communicate to clients that 1. Incidents of violence are recorded and flagged. Should you be a part of an incident of workplace violence where your behavior results in or could have resulted in physical injury to another person, the incident will be recorded in SMIS and a behavioral risk alert will appear on your SMIS record. 2. Information regarding violent behavior will be shared. Information about the incident can and may be shared with other programs using SMIS when you access their services. This information is shared to support putting plans in place to reduce the risk of another violent incident from occurring. Behavioral risk alerts on your SMIS record will be reviewed on a regular basis and may be removed. Ask staff for more information about BRASS. Assure the client that behavioral risk alerts do not create barriers for accessing shelter services and supports. The alerts support shelter providers in having more information to safely work with clients in preventing incidents of workplace violence from reoccurring. Clients or providers are able to escalate their concerns relating to a behavioral risk alert via TSSS's complaint process. To facilitate this request, TSSS can be contacted by completing this complaint form. Select the Close button to return to the base slide. And that's it. I'm so sorry for skipping through that. I was just too excited with the clicking. Back to you, Tina.
Thanks, Maria. No problem. I'm hearing an echo. Do you guys hear that too? No? Okay. Okay. I know that was a lot of information to process. And we will be making this recording and everything available on the city's website very shortly. I'm also just going to put in the chat, on April 5th, we did release a bulletin to the sector that at a high level overviews some of this information, and we will be updating that bulletin with the visual aid that this training refers to, as well as a directive that's going to go hand in hand with the rollout of BRASS. And the directive are slight changes to the Toronto Shelter Standards and the 24-hour respite standards to accommodate kind of some of the the requirements as it relates to BRASS. A lot of it was covered in the training, for example, like notifying clients at intake that the system exists, like that will be an amendment to the standards, as well as like, you know, and letting providers know, and like it will be in the standards, that service cannot be denied solely on the basis of these alerts being on a client's record, and so on and so forth. So all of those things are going to be coming out in the next few days, but that bulletin that was released on April 5th details kind of at a high level what BRASS is and the role of providers and the role of us as TSS. And yeah, I just wanted to point folks to that, and we will continue to kind of redirect to those resources. We're trying to, like, you know, consolidate everything into like one thing so that people can just refer to that, and then there'll be referring links to other resources as needed. Thank you, Catherine, for your comment. She just messaged us. So I just want to open up the floor at this time for any questions that came up as it relates to the training content or about BRASS at large. We have quite a bit of time left, so you're welcome to put your question in the chat. You're also welcome to raise your hand, and we are monitoring the attendees list, and we can unmute you, and you can ask your question out loud, or once again, you can ask it in the chat. I do have a question coming in that's just been sent to me, and I'm just going to say it out loud so that we can all answer it. I was asked, how long does the alert stay on the SMIS record for? So that's a great question. We are aiming to review alerts at about the 3-month mark or so. And based on a set of criteria about, like, you know, if the client has been part of other incidents, how severe the incident was, then assessing if the alert should be extended or can be removed. I do want to note that we have done a lot of thinking about this question about the length of the alert on the SMIS record, and we've tried to do our best to consult other similar environments. So, for example, hospital systems also have these safety alerts. We're aware that other shelter providers within their own case management systems have a safety alert system within their case management system, like in Pirouette or things like that, as well as we know our colleagues in Employment and Social Services, so the division that oversees the Ontario Works program, they also have a safety alert system. So we've tried to consult other folks on like the length of their alerts and when these kind of incidents happen. And the truth is, there's not really a comparable environment to the environment that we operate in shelters, just because of the ongoing nature in which we work with clients. So, for example, some of these systems never remove alerts, or they'll review them every 12 months or 18 months. And to us, that seemed very lengthy because, you know, we interact with clients so often. And so we're aiming at this 3-month mark for now. And we will adapt as, you know, as the rollout continues, but that's where we've set up, how we've set up the thinking as of now. And if other folks want to add to that, please go ahead. I see a question from Ruth here. Does the alert stay on longer if there have been more than 1 or 2 alerts on the client's file? Bonnie, do you want to take that?
Yeah, so that's one of the things that we're thinking about just in terms of that 3-month review process. If at that 3-month mark there's been no additional incidents, then that might be a factor in considering to remove that alert. But if in that 3-month period there have been additional incidents, then we would continue to kind of, from the date of the last incident, you know, push that 3-month review forward. You know, as Tina said, we are wanting to kind of see a little bit about how this plays out. We've made a commitment to look at incidents at behavioral risk alerts at the 3-month mark. It may mean that we need to kind of push that to 6 months. We have to kind of see the volume of alerts that are generated, and also the number of alerts that are inappropriately generated that on the back end we need to remove. So if we're in our back end review of incidents that have generated alerts, look at those alerts and see that threshold hasn't been met, that criteria has not been met, we may remove those more immediately in the back end. and we wouldn't be waiting for that 3-month mark. There's a couple of different places on the back end where we can be looking in to see if the system's being used appropriately, if the right checks and balances are in place in terms of the supervisor reviews and approvals. And Tina, maybe I'll just move into the next question, which is kind of on that same note around if there's kind of disagreement or differing opinion at a site, if a worker has completed an incident report in SMIS and feels that that incident was workplace violence, I would suggest that you escalate that internally within your organization before you would bring that to TSSS. I'm sure you have joint health and safety committees within your sites. That might be a good place to kind of raise that concern that a worker felt that there was an incident of workplace violence that didn't result in a flag. And so I would encourage you to use those internal processes at your sites first and exhaust those before bringing that forward. And as I think is mentioned in the training and will be in the other materials, we'll be using the complaints process that's already in place to respond to questions or concerns related to BRASS alerts. So yes, an ARO is also a place where you can bring that concern as well, you know, after you've kind of looked at what your internal processes are. Tina, I'll turn it back to you.
Thanks, Bonnie. And we have a question here. Would you be notifying the shelter if a BRASS alert was approved but ended up being removed on the back end?
Another great question. I think it's going to depend on the volume that we see when this first launches. We're very mindful that, as I mentioned off the top, that this is a change management endeavor. Information sometimes takes a while to kind of trickle down to frontline staff. And so in the beginning, we may just be removing those alerts and taking note if we see trends, if there's a particular staff person or a particular provider that doesn't seem to be kind of using the system appropriately, we would go through the ARO and follow up on those. It will depend what our capacity is to follow up on each alert. I think the important thing is, especially if there is, it's clearly not an appropriate use of the system, we might remove that alert first and follow up later. Or if we feel that it looks like it was a very serious incident, but there was information missing, we would follow up to see, is there more information missing in this incident report? If that was better completed, that yes, in fact, this is an incident that really requires an alert. So we'll be doing a bit of triaging on our end in terms of that follow-up with providers.
Thanks, Bonnie. And I just want to note on that comment, like one of the most, we anticipate the most common reasons for removal is actually insufficient details within the incident report. And that is one of the questions actually in SMIS. So this supervisor review piece is going to become live on April 24th. That's not currently in SMIS. That's one of the updates. And it asks the supervisor, and everyone can see it, like it's visible. It's only just the people with the supervisor access that can toggle it. But case like all SMIS users be able to see that question. And the question asks, was there potential for this to really result in physical injury to workers, as well as was there sufficient details in this incident report? So, you know, the system is about sharing information, so it's really only as good as the information you provide in it. You know, if an incident report is completed with 1 sentence or 2 words, then it's not really, the next provider can actually not get a lot of information from that. And when the duty office goes into that incident report and they see that limited amount of information, that's not very useful for both the duty office or the next provider receiving that client. So that's going to be one of the most common examples where we anticipate removing alerts, because we don't want there to be then it's meaningless, right? And the client has this alert on their record without much justification. And as the training was alluding to, like the justifiable piece is very critical. So that is one of the cases where we anticipate that the most, and that's where we really encourage folks to complete these incident reports with a good attention to detail and sufficient details regarding like who was involved, what happened, what kind of led to it, what escalated it, and things like that, of that nature.
Tina, Clarence put his hand up. If you want to take his question now, I can unmute him before we move on to, I believe we had a question in the chat as well. So Clarence, if you are ready, I'm going to unmute you right now, and please feel free to go ahead and ask your question. Hi, Clarence, you're unmuted.
Sorry, I think I did that by mistake. I was answering the phone, sorry.
Oh, no problem at all. We just wanted to make sure we got you if you had any questions.
Thank,
No worries
thank
at
you.
all. Okay, so Tina, yet there's another question in there for you to move.
Do you want to read it out, Maria?
Absolutely. It says, will the organization that flagged the alert the first time be notified upon client's return to the site after the 3-month period? I am asking this as there might be workers that might have been involved with prior incidents.
Maybe I can take that one. So one of the important things to remember about us implementing this new system, and I think it's in the training, is this doesn't replace what your current agency practices are. So many agencies do maintain information about clients who've had violent incidents in their locations in the past and may have specific plans in place already for working with this client. So even if an alert has been placed in SMIS and through the alert process, that alert is removed, certainly that provider has every right to have, created their own system to continue to keep information about clients that have been violent in their program and share that information with their staff. The other thing that this allows for is more for sharing information across programs. So when that client returns to your program, it may be a protocol that you already have at your site to pull up previous incidents that happened with that client at your site. And SMIS still allows you to see that. You can look at all the case notes that you've entered for that client, all the incident reports related to that client, and that's probably good practice already when a client's coming into your shelter to look at what's the previous day of this client look like. What BRAS is doing is allowing information to be shared with a site if something's happened at another site, and they would have no way of knowing about that without BRAS being in place. And so this is a way for workers across the shelter system to be informed about potential risks from clients with violent behavior that have been violent maybe in other programs and not theirs. So I know that's more of a complex answer to that question, but I think, think about what you would be doing prior to BRAS existing, that you can always look through your case notes and information about clients that have previously been in your program. And if there are things that are concerning, make sure that that's shared across your agency or across your program.
And Tina, there's another question if you'd like me to read it out. Yes, of course, there's additional responses to that first query. Nope. All right. So I'm sure this team is aware of the potential bias and even fear that this alert can bring up in some staff. As we clear in the language around the intent of this alert, do you have advice around that? I can also see staff demanding to want to know details of the incident leading to the alert and not just the safety plan. Any advice on your expert's end?
I believe you're likely referring to the bias that it may bring up for staff towards the client, right? Does everyone else also understand the question to be that way?
Yes.
Okay.
Yes.
Yes, I think that's yes, I see, and you've responded yes. So I think that is a very valid concern, especially in the initial rollout of the system, and I think that is where we ourselves as TSSS and encouraging all of our providers and the leadership in the sector to join us in trying to ensure that staff understand this as a way to support them and support their work in the shelter system, rather than a something that will make their their work more unsafe. So I think that is one thing that we're really trying to push. And we've, when you talk to your agency review officer or you consult the training, like we're really trying to enforce that this is intended to support workers and having more information than they would have before in order to do their job more safely. Rather than before, right now there is very limited information unless, like Bonnie was saying, that the incident may have happened at your site. So I think the change management aspect of this is very important, as Bonnie has mentioned a few times. And we really ask that you folks help us in championing like the spirit of really what this is trying to achieve. It is not intended in any way as a consequence for clients. It's actually just intended as a system to provide workers with more information so that they can more proactively safety plan or case plan for that client. As we move forward with the rollout and we get more questions and feedback, we're considering we will be putting together like a frequently asked questions document. And later, as we move to the rollout, we'll see if there's resources that we can create, like this thing around you're talking about language, and we'll try our best to see how we can support in providing some of those resources. But at this time, we really encourage all providers to work with their staff and saying this is a new thing that's hopefully going to help us do our work more safely rather than less safely. We anticipate that, as time goes on, it will just become very normalized. Like in the beginning, naturally, any person may feel a bit of anxiety seeing this alert. But as time goes on, a year down the line, 2 years down the line, this will just be part of SMIS and part of our sector. And we are going to be very hands-on in the beginning and continue to monitoring as long as this is as long as SMIS exists and as long as we are the division that oversees it, like we will continue to monitor it, but especially in the beginning, like we will have a very hands-on approach to try to support troubleshooting at sites. Bonnie, do you have anything to add to that?
Well, one thing I always kind of mention to help us kind of ground where we are, that these are not new clients. These are the same clients that you're very expert on providing service to. These are the same incidents that you've already managed and dealt with at your site. You just now have information about an individual that maybe you didn't have before. And so it's really important, and I get, the nature of the question around staff feeling fearful or staff being, having a heightened response around seeing this alert. And yes, we know in the beginning, as the person sees the first alert and you go through that process, there is going to be that reaction. But, as Tina's mentioned, we hope that this is normalized over time and embraced in a way that is helpful, that is really meaningful in terms of developing case plans and having those conversations with clients. We know maybe you've had some challenges in the past at a previous shelter. We want your stay here to be successful. How can we support you? What are some things we can put in place? What are some triggers that maybe we should be aware of so that things don't escalate and your time with us is supported. So we know that some of these, support with some of these conversations or how this will play out is something that is going to, continue to be needed as we start to see these alerts on clients' files. But as Tina mentioned, we'll be working on additional resources and really looking for kind of champions across the sector to help us to, use this information in a way that is supportive and that is helpful and not in a way that's creating barriers for clients or creating unnecessary fear or anxiety for staff. We want this to be viewed by staff as something that's helpful and supportive to their work.
Thanks, Bonnie. I see there's a few more questions. I'm just going to read one that's come to me directly, if that's okay, and then we can move to the one in the Q&A section, Maria. I see that one too. The question asks, how long do staff have to submit an incident report? So it's a very good question. So the Toronto for shelter providers, I'm going to talk to shelter providers first, but it's very similar for respite providers as well. So shelter providers are required to document serious occurrences in SMIS using the SMIS incident report module within 12 hours of the incident. So that's what the Toronto Shelter Standards requires. So you can review that section of the Toronto Shelter Standards. It's literally called incident reporting. So typically within 12 hours, the incident is recorded in SMIS. And the new addition, then an amendment that we're making to the Toronto Shelter Standards that will come out in the directive in the next couple of days, will reiterate that a supervisor from that, that first report that's great, the supervisor will be required to review that within 24 hours of the initial. So the report is going to be created within 12 hours, and the supervisor has 24 hours after that to review and make a decision on that alert. And the reason for those timelines also just have to do with trying our best to make sure the system is current and up to date and the information flow is happening, versus, if you let something sit for weeks on end and maybe the client has been discharged, the next site won't be able to access that information if this incident report hasn't been completed or the supervisor hasn't reviewed it. We recognize and understand that this is going to take some time to accommodate business processes at the site level to these timelines, and we are patient in working with you to do that. We're not going to be documenting for compliance the next week. It's not going to look like that. It will take time for the rollout to happen and for providers to get used to these new features in SMIS and to know that the supervisor has to review it and make a decision and all of those things. So we totally understand that, but that is the timelines as currently required in the shelter standard. So serious occurrences are to be documented within 12 hours.
Hi, Tina, I do have one question that came in privately, if I can read it. So are there mechanisms for individuals to report concerns or grievances related to data privacy and security within the behavioral risk alert system? And how are these being addressed?
Yes.
Maybe I can take that question. That's another excellent question. So as it states now, any privacy breaches related to SMIS need to be reported to TSSS. And Vanita, who's a supervisor on my team, is the point person for that. So I would refer to the same procedures, and it's part of your operating agreement. It's all if you're a purchase of service provider. It's also part of the SMIS privacy guidelines, which you can find online, that any breaches of privacy need to be reported to us, and we will investigate those. We will also loop in the privacy office as needed. We certainly have consulted quite extensively, not just with our lawyers at the city, but also with our privacy office at the city to ensure that the processes we put in place for this system are in compliance with NFIPA and other privacy regulations. So certainly report those, or you can always go through the city's complaints process. So if you as a provider or as a worker at a shelter feel that things aren't being used appropriately or there's been a breach, you can always just put that through as a complaint, and we can follow up with you individually and then investigate that further, first connecting with you and then following up with the provider as needed. So hopefully that helps. There's kind of two pathways there, but if you want to raise it as a complaint or as a privacy breach, there's two options there.
Maria, do you mind just reading the Q&A one?
Q&A? Sure.
Yeah.
I believe you might have already responded to it, but just in case you have some additional responses to the question. Has possible effects in staff interactions with clients with such labels been anticipated?
Yes, yeah. So I think I just want to make sure all the questions are being read out loud, and I can also just ask my co-panelists to make sure if you might be getting questions privately, just to read those out if you're just double check for that. Yeah, I think we've tried our best to address that. Yes, it was definitely when we also did our engagement sessions in the spring of last year. There was a lot of discussion about that, and once again, we're hoping that as all the folks you attending this training, leaders in the sector, supervisors, managers, and workers, the more we can champion this as not a way to punish clients anyway, but that this is actually just helping workers get more information to do their job more accurately. That is a way that we're really hoping to fight off the stigma that may come from these alerts. But really, these alerts are cannot be used to deny service to clients by any means. These are the same clients we've always had. This now just allows for more information sharing about those clients as it relates to incidents of violence if they've been part of that. And the visual aid we've been alluding to, that's going to be actually like a notice of collection as the training was highlighting. So that will be required for all sites to put up in inconspicuous areas. So clients will know this system exists and they have the right to know that. So that is one way where it's not also intended to be we're hoping that we can be transparent about it and letting clients know, like, should you be part of incidents like this, like, it will be recorded, there will be an alert on your record. And the poster also says these alerts are routinely reviewed and they may be removed. So we can communicate all that information to clients freely.
I checked my messages. I don't have any privately sent to me.
Okay. Just want to do another call out. If folks want to raise their hand, they're able to, and we can unmute you and you can ask your question or provide any comments. Or if not, the chat has been working very well, so you can feel free to continue to put the questions in the chat.
Just while we're waiting, if there's any more questions, I just also wanted to add that, you know, as Tina's mentioned, we've shared our bulletin and we will be sharing a directive. And of course, we're recording this session and we'll be sharing that as well. But really the way that things have been, you know, adjusted in SMIS, it's very intuitive and very easy to kind of follow along. So if you feel that, you know, there'll be some challenges in terms of getting staff to the training or having them watch this session or future sessions, really leaning in on that bulletin that we've provided and leaning in on the directive, all the information you need is really there. The training that we've developed, the session we have today, is really just to give us a bit more opportunity to work through the complexity of this because, you know, as we've talked about, we know that there'll be some challenges and we know that it's going to take us a while to get to a place where this has been normalized. So in the short term, we're hoping that with those materials that we'll be providing this week, there'll be enough for us to start using the system and react to the system. And we certainly can, as I've already mentioned, you know, provide additional materials or provide additional content, or Tina's mentioned a frequently asked questions document to really support you going forward. So really appreciate even the questions and feedback we're getting today. Very helpful as we continue to evolve the materials that we're sharing. So I just want to say thanks again to everybody today that participated. We have 85 participants, which is amazing. So thank you, and looking forward to sharing the training materials in May and June. More of Maria's wonderful narration. Thank you.
Thanks so much, Bonnie, for that. I do have one last question. I'm sorry. Silencing my spam call that I'm sure everyone is getting all the time. I have one last question that's been asked to me, and Bonnie, maybe I'll have you answer it. The question asks, how many violations can cause a client to be discharged?
Well, I think there's a difference between this system, the behavioral risk alert system, and service restrictions and, you know, consequences for clients. And so there's many different, you know, benchmarks. There's certainly, you know, within shelter standards, it talks about serious occurrences and things that need to be documented and behaviors that need to be documented at sites. So we know that there is a lot of, you know, variation, let's say, across programs. Some programs are a little bit more low barrier. Other programs are very clear right at intake. These are the rules of the program. These are the expectations of the program. If you do X, Y, and Z, these will be the consequences. And so that's kind of a general question that's maybe a little bit difficult to answer. But really, we have to think about BRASS as different than a consequence system. And BRASS is really leaning in on the occupational health and safety definition of workplace violence. And this piece around serious physical injury to staff or serious physical injury to others or a real serious threat to physically injure somebody, because it's on that basis that this information is shared. So if somebody is just verbally abusive, that doesn't meet the threshold, and that would not be something we would share. It's really that piece around the physical injury threat, and that creates the basis from a privacy perspective, from a legislation perspective, for us to be able to share this information. And so in terms of consequences for various, incidents at a site, that's different. That's handled by service restrictions or timeouts or whatever your process is. This is really around sharing information of incidents of violence with the next program that works with this client. So hopefully we can mitigate those risks and maybe learn from, what happened at the past shelter and put some supports in place so that we don't have the same outcome at the next site.
I see a hand raised here, Maria. Do we maybe want to unmute Catherine?
Absolutely. Catherine, you are unmuted. The floor is yours.
Hello, everyone.
Hi.
I don't really have a question. I just want to say the amazing job you guys did, because when I did my training, I think it was about 2 months ago at City about Metro Hall, we were asked about this same question: if how do we feel about them trying to implement this? And I think 95% of us agree to it, that it's good for it to be in the system, and just 5% said no. And I brought it up. I think there was another guy who works at OW. I did raise it up that I was at OW for about 2 months, and this is actually in the system. So what's preventing shelter system from having this, from implementing it? Because when you see it, when we do intake, we have the client sitting right in front of us, and we don't have those information at hand. But even OW, they don't do as much as we do comparing to when you're doing all the intakes. So why don't we have this information? And the client, they're staying there, we see them like almost every day. But the OW, like their staff, their worker can see them like maybe once in 3 months, and they still have this in the system. So why can't shelter system implement this? So I'm really glad that this is here now for us to see. And I'm also happy that it's not just about the staff alone, that we're also working for the good of the client, because it's not a barrier. It doesn't stop them from still being admitted into the program. And I'm really glad, like, whoever came up with this whole implement and everything, like, I'm really, really proud of you guys, and it's an amazing job. I know you guys came a long way to put all this together, but I'm really glad that you guys did this, because anytime we see this, it's for our own safety, and it's also for the safety of the clients on how we can support them moving forward, and also for us to be aware that, okay, this is what's going on, and how can we move forward? How can we support this client? So I'm really happy about this, and I just want to say amazing job, Katanya, amazing job, Maria, amazing job, Tina, amazing job, Benny. Thank you so much for doing this. It's come through a long way, and it's something that really needs to be done. Thank you so much.
Well, thank you, Catherine. Looks like Catherine put together a conclusion for us. Thank you, Catherine.
You're welcome.
Thank you so much, Catherine. We very much appreciate your comments and your insight. That's very, very, very good insight as well. Okay. I'm not seeing any other questions coming in. I don't know if my co-panelists, I don't see anything in my chat. And I'm not seeing any other raised hands. So I think with that, we can wrap up this session. As we mentioned, there will be 2 upcoming sessions as well, on May 30th and June 5th. And we will send reminders out before that happens, so you can promote it to your colleagues and ensure that folks get registered and attend. And when the training content's available, we will be updating the bulletin with the where the recording link is, and it will all be available on the city website. So thank you all for attending this afternoon. I see a final question in the chat about are we doing this training again at a self-paced? If you have attended today's training, it will count as you have attended the training, and we have a registered list of it, so we know who has attended it. But for folks who are not here today, we will have future sessions, and we will be eventually making the module that Maria went through available as a self-paced module, just so that kind of like lives on infinitely. And we don't do these sessions every week or so, but that will be always available for all SMIS users to access.
And
Okay.
so just so you know, the May 30th and the June 5th training sessions are going to be the exact same concept where with your attendance and the viewing of the module, we can then update your transcript as having completed this training. But of course, you can do it all over again if you'd like, you know, on your own time, no problem. But that might be a good way of promoting it to your colleagues, right? Easy and quick way to get it checked off of their transcript and learn everything there is to learn about the Behavioral Risk Alert Safety System.
Thanks, Maria. And I'm just getting some questions privately, I anticipate, from folks that work at the city. So from our city operated shelters about attendance approval for joining this session, or how do we prove the attendance. I kindly ask that you escalate that to your shift leader or supervisor on site and let them know that you attended this session. And you can get in touch with Catania and Maria, like we can send a follow-up to the city folks maybe that joined today and let them know that if you require, like we know that you registered for the session, so we know that you attended, so we can confirm that for your shift leader or supervisor that you were present today, and we can sort that out afterwards. But if that's okay,
Yes.
Maria.
Yeah, no,
For
that's
the-
perfectly fine. I'm going to cross-reference the registration list with the attendance list because there's quite a few people on phone numbers. So if you would like to also send myself or Catania an email to just kind of clarify, this is me, this is my registration name, this was my phone number, so that we can ensure you receive credit for attendance today. And exactly what Tina said, if your supervisor needs confirmation of your attendance, feel free to redirect them to us and we can absolutely confirm that on your behalf.
Great. Okay, thank you. Have a good afternoon, everyone. And yeah, that's it. Have a good afternoon.
Thank you so much. Take care.
Thanks so much, everybody. Take care.